A CBT scan is a three-dimensional X-ray. And what it gives us a lot of information. And what I do when the patients take it, I send it to a radiologist, which I pay out of pocket for, because I think it's best if we get a written report back, because what it looks at, it can look at the vertebrae in your neck, it can tell us if you have any compression, it can look at your sinuses and tell us what's going on with that area. And also it looks at each individual tooth. We can see it in a 3D design. So we can see, what's going on with the teeth, we can see how much bone you have. And also it looks at your TMJ joints, because a lot of people grind and clench their teeth. We can see where they're atrophy and things of that nature, and if you need to be referred outward. So I recommend that every patient get one every 2 years. A lot of times the standard of care was to use them for like when you were planning dental implants, but I happened to go to a seminar and they said, well, all your patients can benefit because even some diseases will show markers, so that's why I sent it out to radiologists so we can get a written report back. So when a patient comes back, we sit down and we review it. If I get the report back, if there's something that's urgent, I will call the patient in and we'll discuss it.